Good day, my peeps. Welcome to my channel, Yardman Second Chance channel.
I know you guys inform and inspire. What else?
Motivate and educate.
You have anything else to say?
If you've got a story, you can call me and share your story.
What kind of story?
Like if you've been deported and you've reformed, given pardon, and returned to the country you've been deported from.
Is that all?
If you've been to prison, done your time, you rehabilitate and living a new life.
Nah, answer no more question, my general. Tell them to go subscribe to the channel right now.
Yeah, nighttime, my peeps. Nighttime. Well, this is the Yardman Second Chance show. You know, show inform, inspire, motivate, and educate. But first, we have to give God thanks for life. All right? We have to endorse God in everything we do. Thank you, Father God, for another day on top of the earth. Thank you for preservation of life. And big up all my subscribers out there. All the man who subscribe to Yardman Second Chance. Right? Blessings. All the people in the diaspora who are subscribed to the Yardman show. Well, tonight we are dealing with something important. This one here for the man them. We are talking about prostate. Enough man no want to hear the word there, no. Long time these people used to call it stoppage of water. But now, modern time now, we know it's a prostate. Man, I'm afraid to go to a doctor to go get them check up. Seeing? But you have symptoms so you can know if you have prostate, you know. I go and get down in the meat of the matter right now. Tonight I'm not joke thing, you know. More the man him to listen. Seeing? Keenly. Because this is too much of my brother them are dead from them thing there. Especially down a yard. Man them down a yard no want to take no test. So true that most of the man them are dead out. After through the cancer, prostate cancer. Enough man they say prostate kill him. Prostate kill him. But first, I go and play this and make you get the full understanding what is prostate. Because enough people don't know. Enough people don't know what is prostate. Listen up.
Prostate cancer is the most commonly diagnosed cancer in men in the UK.
And Jamaica.
So where is the prostate? It's here, under the bladder, surrounding the urethra. That's the tube that carries urine or wee out of the body. Who has a prostate? The following people have a prostate: men, trans women, non-binary people who were assigned male at birth, and some intersex people. So what can go wrong? Common prostate problems include an enlarged prostate, prostatitis, which is an infection or inflammation of the prostate, and prostate cancer. Common symptoms of a prostate problem include needing to urinate more often than usual, especially at night, difficulty starting to urinate, a weak flow, or a sudden need to urinate. But most men with early prostate cancer have no symptoms at all. So are you at risk? In the UK, 1 in 8 men will be diagnosed with prostate cancer in their lifetime. If you're black, you're at a higher risk. 1 in 4 black men will get prostate cancer. You're 2.5 times more likely to get prostate cancer if your father or brother had it.
I mean, if you're running in your family, you will get it.
Risk of prostate cancer if your mother or sister has had breast cancer. Prostate cancer mainly affects men over the age of 50, and your risk increases as you get older. If you have any questions or concerns about you or a loved one, there's help available. Talk to your GP, take our 30-second online risk checker, speak to one of our specialist nurses on 0800 074.
Right? The material say the prostate cancer. It's a heredity thing still, you know. If you run in your family, you will stand a chance to catch it. Otherwise, people can catch it still without being a heredity. You know, depends on your lifestyle. But there are symptoms of the prostate cancer. I'm gonna play you this next clippings. I tell you, say a serious thing the hard man I deal with tonight, and I'm one of the man them listening. This one dedicated to all of the man them, because I don't know, say I know woman sickness this. Woman have breast cancer, man have prostate cancer. Right? This are for the man them. Listen up to some of the we're gonna play some of the symptoms. Listen up.
The prostate is a vital element of the male biological reproductive system. It's about the size and shape of a walnut, but if left unchecked, this small gland can cause big problems. Prostate cancer is one of the most common cancers affecting people with male reproductive organs. Each year, close to 200,000 Americans receive a diagnosis of prostate cancer.
Serious thing
About
going
1 in
on.
9 people with a prostate will receive a prostate cancer diagnosis during their lifetime. This includes men, transgender women, intersex people, and non-binary people with biologically male sex organs. One of the best indicators of whether you're at risk for prostate cancer is your family history. You're 2 to 3 times more likely to get prostate cancer if your biological father, brother, or son has the disease. Another risk factor is age. Your chances of developing prostate cancer increase as you get older. It's most common after age 50, and more than half of cases occur in people over age 65. There are some other risk factors too, including race, weight, and whether you smoke. But the reality is that prostate cancer can and does affect men of all backgrounds and lifestyles. Early stage prostate cancer rarely causes symptoms, but as the disease progresses, you may experience certain warning signs. So what should you be on the lookout for? Knowing the symptoms of prostate cancer will help you keep an eye out for any concerning changes to your health.
Yeah.
Keep in mind, though, these symptoms do not indicate trouble with your prostate. And in fact, most all of them come standard with aging. But if you experience several symptoms or have other concerns, it may be a good idea to visit a urologist.
Any of them symptoms, I just check your doctor.
Most men will have
Listen.
trouble urinating as they age. You might experience a slow or weak urine flow, or your urine flow might start and stop beyond your ability to control it. Though this isn't usually due to prostate cancer, it may be a good idea to get your prostate checked.
That number
A
one.
rare but early sign of prostate trouble is
Listen.
unexplained pain in the area of your prostate, especially when you're sitting down. This could also indicate a prostate infection, but only your urologist can say for certain. A
Right?
tumor on the prostate can put pressure on your bladder and urethra, so take note if you start to feel a frequent and sometimes urgent need to urinate, especially at night. You might also feel pain or a burning sensation when you urinate, a condition known as dysuria. This condition is most commonly associated with urinary tract infections, but it can sometimes be a sign of prostate cancer. You could experience a loss of bladder control, as well as problems controlling your bowel movements. It may hurt when you ejaculate, or you may not be able to keep an erection. And you may notice blood in your semen or urine. Finally, as prostate cancer progresses, it may cause pain in your lower back, hips, or chest, as well as numbness in your legs or feet. Again, none of these is a surefire sign of prostate cancer, but they might warrant a visit to the urologist. There's no way to eliminate your risk of getting prostate cancer, but if you're at higher risk for developing the disease, there are steps you can take to lower your risk. Get regular prostate screenings. Maintain a healthy weight. Exercise regularly. Eat a nutritious diet. And quit smoking. Prostate cancer is a serious disease, but early detection is key. Talk to your doctor about your risk factors and when or if you should be screened for prostate cancer, sometimes as early as age 40 if you're considered high risk. When prostate cancer is diagnosed before it spreads to other parts of the body, about 97% of people live at least 5 years after diagnosis. So pay attention to your prostate. It may be small, but knowing the warning signs can benefit your health in a big way.
You hear that? All them signs with them read out just now. Have to look out for them thing there. Seeing? Lots of signs. Right? So you have to listen out for them thing there. Watch out for them signs. Prostate thing a serious thing, brother. Right? I'm going to play a next clip. I want the man to pay attention, you know. A school, yard man a school on it today. Yard man a school on it today, you know.
With targeted video ad.
Yard man a school, you know. We are telling about the enlarged prostate now. When your prostate enlarged, we're going to tell you what it's like. Listen up. Right?
If you have benign prostatic hyperplasia,
Listen
or BPH, your prostate gland is enlarged. The prostate is a walnut-sized gland in men. Just beneath your bladder, your prostate gland surrounds your urethra, the tube through which urine and semen exit your body. Your seminal vesicles
Pay
and
attention,
prostate
gentlemen.
make fluid that combines with sperm cells to create
This
semen.
program out for the man them tonight.
During normal urination, urine flows from your bladder through the part of your urethra inside your prostate, then through the rest of your urethra to leave your body. For unknown reasons, your prostate gland may enlarge as you get older. If you have benign prostatic hyperplasia, your prostate may grow large enough to narrow or block the part of your urethra that runs through it. As a result, your enlarged prostate may slow or block the urine flow out of your body when you urinate. The symptoms of benign prostatic hyperplasia include frequent urination or urge to urinate, especially at night, a weak or interrupted urine stream, and straining to urinate. Over time, untreated benign prostatic hyperplasia may cause the following complications: inability to urinate, damage to your bladder and kidneys, bladder infections, bladder stones, and urine leakage called incontinence. If you have benign prostatic hyperplasia with mild or no symptoms, your doctor may recommend watchful waiting, which includes getting your prostate checked every year to make sure your symptoms or health are not getting worse. If you have moderate symptoms that bother you, your doctor may recommend medication, such as alpha blockers. Alpha blockers relax muscle tissue in the neck of your bladder and in the urethra to improve your urine flow. 5-alpha reductase inhibitors may also improve urine flow over several months by reducing the size of your prostate. You may receive a combination therapy of both types of drugs. If medication isn't relieving your symptoms, your doctor may recommend a surgical procedure called transurethral resection of the prostate, or TURP. During this procedure, your surgeon will insert an instrument called a cystoscope through your urethra to reach your prostate. Then a wire tool called a resectoscope will be inserted through the cystoscope to shave off tissue, which will widen your urethra. Other minimally invasive variations on this type of procedure use lasers, microwaves, radio waves, or electrical energy from tools inserted through the cystoscope to remove some or all of your prostate gland. If your prostate is very large, your doctor may recommend an open prostatectomy procedure. In open prostatectomy, your surgeon will make an incision in your lower abdomen. After exposing your prostate, your surgeon will make an incision in its outer capsule. Next, the tissue inside your prostate will be removed, and the capsule incision will be closed with sutures. Finally, your skin incision will be closed with sutures or staples. You can't prevent benign prostatic hyperplasia, but the following lifestyle changes can make your symptoms less severe. Avoid medication that can make it harder for you to urinate, such as antihistamines and decongestants. Stop drinking fluids for a few hours before bedtime. Avoid drinking alcohol or fluids that contain caffeine. Try to empty your bladder by double voiding. To double void, urinate, wait a few minutes, and then try to urinate again.
Wondering what
So you
happens
hear
when
that,
a
my
swollen
peeps?
prostate
You hear
tightens
that?
up?
You hear that?
Prostate. Do this 15-second Japanese ritual that shrank mine almost immediately. And
All right. We'll talk a little bit on this. Enough man afraid for go get them prostate check, you know, even me. Even me afraid of them thing there. You know? But the signs are there. So once you have the symptoms, you have to just make up your mind and say, boy, you have to deal with it. Especially when you're reaching a certain age. From age 40. You have to start check up on your thing. So the man, them want to pay keen attention to them things that we just play, you know. And a joke thing, you know. Because you know, so the health is wealth. Health is wealth. And the money where you have, you know. Because enough man have a bag of money. All the money in the world, the man them have. And when prostate cancer take them, and them never check up on it, the money can't help them. Them are go dead left all of the money. And they can't carry a cent with them. Not even 1 cent. Right? So the man them for pay keen attention to no health. Tonight, I deal with the health issue with the man them. The man them night tonight. See? You don't know. And on a lighter note, before we cut out of this show here tonight, on a lighter note, I want you to listen to this thing here. A prostate test gone wrong. A man go for go do prostate examination and it go wrong. I want you to listen up. See? I go cheer up on your spirit because you not worry a while ago about prostate and a fret. Don't fret. You know, life goes on. You just have to take care of yourself. But listen up to this local drama here. We're going with a man who go for go doing prostate. Listen what go on. See? This man go for go doing prostate.
Them say if you check your prostate. So I say, alright then. What do you know? The woman say, boy, you know, you're 42 now in a youth, so them say if you check your prostate. So I say, alright then. Make the appointment. Because, you know, them have insurance, you know. Some of them have for them insurance. So she made the appointment. And I go, Miss One. Nice little petite Indian doctor, you know. Nice girl. A nice young lady then. Let me say that. You know, talk to me and reason me take my vitals and do me look a test. Them take some blood from me because them have the blood work.
Yeah,
and
man, a foreign, you know, listen
you know? And them have to send the guy lab. So I say, alright then, go and do nothing, brother. So she said she have to check now my prostate, you understand? And she has said, the boy, them have to insert, you know, them finger and feel up and down and feel if the prostate, the gland has swell. You understand? For all who don't know about the prostate, brother. The prostate I want to hold the sperm water. Not the sperm, you know. The lubricant. When the sperm come down, it mix with the fluid. You understand? So sometimes that swell up and push against your pipe. Will carry out the pee-pee through your hood. You understand what I say? So when that swell up now, it kind of block off the pee-pee hole. It push against it and kind of close. Just like when you have a hose and you squeeze up the hose together and the water come out a little bit or same way. So each time when you pee-pee, or when you use the bathroom, it's like you have to shake, you know, because all light never really come out. You understand? You know, flow straight like that. You understand? Like when you're a young boy or your son or so. So the prostate get bigger. So they feel if you see, you know, what size it is and estimate it and so. So I say, all right, no problem. So she say, all right, somebody will be there. So I said to myself, I sit down in my room now, she take off my clothes and put on my little gown and sit down on bed and wait. And I say, the lady must go and wash her hand and clean up herself, you know, to come back in, come test the prostate, you know, go insert. You know, me look on her finger, them and nice petite girl. I say, all right, them must handle that. Brother, me say no man. To judgment all you know people. Mighty God of Daniel. All of a sudden, me don't know where this doctor come from, you know, brother. One big, thick man, you know, brother. You know the white man with oversized, brother. And one of them man, they come in, you know, brother. And when we look on the wall, the man, I take one gloves, you know, man. Me know gloves, you know. And then latex gloves, you know. Okay, you know about them things because I'm nurse, you know, not doing, you know. And Miss Pennies and all I know, ladies and the chat, and you know about them things, you know, them. Me said in gloves, when the man take out of the box, mark X, X, L.
Extra large.
Me blood fire.
extra large.
X, X, L. Listen, the blood for that man a push on for the other the tight to go on for the man and the brother. One of man finger come like one little hood in the brother. And that the man the comfy pushing thing inside of me, the brother. Comfy feel me prostate in the brother. One man I put on one gloves XXL in the brother. Remember in the man. My little rump in the man. Never touch it in the man. You understand me? I say, and imagine you're going to be first time and look out for the man on the send. Eh? Brother? I know none of them not see me to blood. Me never go back for result, brother. Me not go back for result for blood test, brother. I know none of them not see me, brother. Wife come on and ask, how was it? Me say, all right. I'll know. They're not then tired to call. They're tired to call. I'll know me not go back, brother. I'll know. You're mighty God of Daniel, brother. No, sir.
Yes, peeps. That was hilarious. Just to make the man them get a little laughing at the end, you know? But this thing's serious. But I follow the brother and run left the thing. Stand up to it and get yourself checked, you know? You know, Yardman Second Chance, we inform, educate, inspire, motivate, and elevate. Tonight we inform the man them who are going with the prostate thing, see? I said the man them forget them check up and thing. And I want to make that make no lose on the life and things, see? Especially down a yard. You know, say man them skeptic for make a man a touch around at the back door there, so. See? But sometimes you have to go do it necessarily. You know? You have to take care of your health. And I like say you have to turn booger man hour. But you have to go prepare yourself for that. Unless you want to just drop out so I don't know what cause what your health situation is. Saying? But you don't know. To each his own, you know. A yard man, I shout out to all of the man them in the diaspora. Big up on yourself, all my subscribers. Big up on yourself, friends and family, wifey, KK, you don't know. So this is the Yardman Second Chance. Keep on subscribing to my show. Right? Like and share my videos. And big up on yourself. And peace out. Yardman Second Chance. Say that.